what's going on? What's going on? This your boy Steve, the kidney nurse. Thanks for joining me. Look, I'm going to be on here for maybe about 15, 20 minutes, no more than 30 minutes, because I got another show I got to host at 8 o'clock. I got a guest. Tune in for that. It's going to be Joe. I don't want to mess up his last name, but Joe Randa, but I don't want to mess up his last name, but Joe R. Kidney warrior, transplant recipient. He wrote a book, number one bestseller on Amazon, Fat to Fit. So he's going to be on tonight and talk about his journey and him being an author. So look, tonight we're going to talk about real quick that a lot of kidney warriors need to know. Share this broadcast because you're not going to get this information from your dialysis unit. Nobody's going to sit down and go over specifically what I'm about to lay out right now. Steve, the kidney nurse. That's why it's so vital. It's so vital to share this broadcast. It's so vital. I'm going to give the 4 people who's watching a minute to share and then come back. All right? Share, please. I'll be right. All right, guys, I'm back. This is so important. I had to do that to go. I'm doing a watch party, and I need to invite as many warriors as I can because this information is so critical, and it's so sad that only 3 people are watching this. I don't know if anybody's watching on YouTube, but if you're watching from YouTube, give me a thumbs up. God bless anyone watching and taking the time out to get this vital information from Steve, the kidney nurse. Now, let me break it down to you and tell you what's going on. Because I've seen in many Facebook groups, patients said that they had experience with chills, shivers, high temperature, vomiting, all the classic signs of a bloodstream infection. And then on top of that, they may have a catheter, but you just don't need to have a catheter to get a bloodstream infection. So I'm going to break this series up into like 3-part series. The first part, we're going to talk about infections in dialysis patients. Then we're going to go from there. All right. So look, this is very important. So listen up, guys. Bloodstream infections are a dangerous complication of dialysis. In fact, it's so dangerous, 1 in 4 patients who get a bloodstream infection caused by staph, you heard of staph, bacteria, can face complications such as endocarditis. You're like, whoa, Steve, the kidney nurse. What's endocarditis? All that is, guys, infected heart valve. Endocarditis, itis is inflammation. That last part. Anything that got itis behind it is inflammation. That's how you know that. All right? So endocarditis is an infected heart valve. Infection can cause that, a bloodstream infection like staph, and it can cause osteomyelitis. Like, damn, Steve, what are you throwing out these big words? Let me tell you what osteomyelitis is. Infected bone. So if you hear doctor come up to you and say, maybe you had an infection and you got admitted to the hospital and you hear them say something about endocarditis, just know you got an infected heart valve, and they giving you antibiotics to get rid of that. Same as you hear them say osteomyelitis, and if you got an infection, okay, if you had an infection or you get multiple infections and you hear that word osteomyelitis, just know you got an infected bone somewhere. Now check this out. Now it may be more. The cost may be more now, but total cost for each infection can be more than $20,000. I beg to differ and say maybe $25,000 to $30,000. All right, if you look at today's infection that's caused by the eating flesh bacteria or staph, and you got some bacteria that are resistant, meaning the antibiotics that they use cannot wipe it away. So you got to find something else, and that something else could cause a medical complication. So you got to really be mindful and know what you're dealing with when you're walking inside these dialysis clinics. You need to make sure the staff are washing their hands, and we're going to get into that. All right. You can't just rely on hand sanitizer. No. You go to CDC, they would tell you that. All right. Bloodstream infections can cause sepsis. You may hear that word thrown around a lot. Sepsis, a potentially deadly, I repeat, a potentially deadly condition. It's so deadly, right? Up to 1 in 5 patients with an infection die within 12 weeks. Okay, just remember that. Let that sink in. Do you get this information from the dialysis unit? No, you go in, they put you on, you stay on till your time is up. They rinse your blood back, remove the needles or cap you off on the catheter, get your vitals, and it's out the door. Next, you need to be armed with this information going into the dialysis unit so you know how to protect yourself from getting a bloodstream infection so you won't end up in your local hospital getting a round of antibiotics on a Friday night. Now, you may say, hey Steve, how do we get these infections? How does it occur? Let me tell you the science, the theory behind it. Very simple. I'm not going to get into any medical jargon and use big words and you not understand it. I'm going to break it down to the simplest level, the street level. That's where I'm at, on the street. I'm in Brooklyn, New York. No, I'm just kidding, guys. This is my green screen. But I mean, one day I want to do a show outside. 2021, when this whole coronavirus kind of subsides and my book take off and I got the funds to do that, we're going to do a show outside live talking to you guys. That's how serious I am about kidney disease and putting it on a national platform. Okay? So let me tell you, okay, how do infections happen? You may be wondering, Steve, damn, get to the point. Okay. You got contact, droplet, and airborne. That's how you can get an infection. Contact, droplet, airborne. You got to have a source, right? You got to have a source. And then you got to have a host, okay? This is the source of the infection. I'm sorry. Right, this is the source. This is the host. Now, there's 3 elements. 3 elements must be present for an infection to occur. a source of germs. So say this person got germs of COVID. We're not talking about COVID tonight, but I will on the 20th. Steve, the kidney nurse, will have a medical doctor. Then we're going to talk about COVID. So mark your calendar, Sunday the 20th at 7 p.m. I'm giving you heads up right now. So you need 3 elements must be present for an infection to occur. A source of germs like bacteria or virus, a susceptible host, meaning a person who is at risk of getting infection from germs, someone with kidney disease, right? Someone with sickle cell, someone with liver disease, someone with a chronic condition is the host. If you go to dialysis 3 days a week, you're a host. If you had a kidney transplant, you're a host. Okay? Now, a way for the germs to move from the source to the host, right? There are 3 ways for germs to move from this source to this host. And I had named it contact, touching, contact, droplets, right? Or airborne transmission. You're speaking into the air. All right. That's very important to know how germs are transmitted. That's why it's very important, if you're watching this, Steve the kidney nurse endorse wearing a mask and staying 6 feet apart and practicing social distancing, including washing your hands, not just hand sanitizer. And stop putting hand sanitizer on latex gloves. We don't do that in the hospital. You go to the dialysis center, you don't see them putting no damn hand sanitizer on rubber gloves and then go and stick another patient. And if you do, you better get out of that clinic fast as hell. I'm serious. If you see someone at your dialysis center, a nurse or a tech, have on gloves and wash their hands with the gloves on or use hand sanitizer, you better call the state. Quick, fast, in a hurry. And I don't care if you got to do it anonymously. Call the damn state if you see something like that. Now let's talk about the type of infections that are in dialysis patients or that you can acquire. Dialysis patients are at risk of getting hepatitis B. That's why when you start dialysis, right? Or if you get ready to start dialysis, or if you just started within the week, at some point they're going to offer you, right, Recumbervax, I'm sorry. And what that is the hepatitis B vaccination. It's a series of 3 shots in your deltoid muscle. 2 cc's, 40 micrograms. That's the dosage. That's the dialysis dosage. 40 micrograms, 2 cc's, and a 3 cc syringe with a 21 gauge, 1-inch needle. Okay? Right here in the deltoid. When you get that shot, right? Get it. Month later, get the second one. And then I believe 6 months after the second shot, you get your 3rd injection. And you should be immunized against Hep B. And the way how they find out if you have immunity, right, is when they draw that lab work. And it's called the hepatitis B antibodies. The antigen, if you got Hep B antigen, you got hepatitis B. Okay? And you're supposed to be sitting in that room away from the other patients. But they test you. Once you get the 3 shots, they're supposed to draw your blood and test for the antibodies to see what your level of antibodies are. And it got to be greater than 10. Okay, so remember that. They're not going to sit down and tell you this. That's why I'm saying this information is so critical. I mean, it's so critical, I got to put it in a book to sell it because there's not enough people watching it. I mean, wouldn't you do it? You know, now I must admit, some patients do know this. I'm not saying that all patients don't know what I'm talking about because they do their research. However, if you never worked for DaVita, Fresenius, US Renal, Advanced Dialysis, I'm trying to think of, Foundation Medical, because I was a travel nurse for like 5 years. I traveled all across the United States. And I don't say that to be bragging or anything like that. I thank God for that experience and journey. I just saying that because of my experience of what I gained over the 33 years. And I'm like the magic magician. I'm the magic nurse giving out secrets that they don't want you to know. Why do you think you ask a question and they short with their answers? If you had a question, do anybody sit down like I'm doing right now? It's 20 minutes. I mean, at 7:09, I could be watching documentaries, learning, building my craft on making a documentary on kidney disease, which I'm going to do, called Urban Crisis. I could be doing other stuff, cleaning up my basement. I mean, it's a mess here, but no, I'm taking the time out to do this because that's what the Spirit said. I say all that to say they're not going to sit down at dialysis and do this. After they put 3 patients on, do you think somebody's going to come to your chair and spend 20 minutes there? No, they're going to go sit and talk to the rest of the techs or go to break, go smoke a cigarette, or go decompress after putting on 3 patients. Because that ain't no, walk in the park. It may look easy, but mentally putting on a patient on dialysis, you can kill them if you're not being watchful and mindful of what you're doing. I've seen it happen. So you say, Steve, you threw out hepatitis B and C infections and bloodstream infections. What is Hep B and Hep C? Okay, let me just tell you. Hep B and C are blood-borne viral infections that can cause chronic, which is lifelong, right? Like kidney disease, lifelong. Chronic kidney disease, lifelong. Disease involving inflammation, which is swelling, right? Inflammation. You hear the word inflammation, just think of swelling, okay? It don't have to be big and technical. If you ever hear a doctor or a nurse at your clinic throw out inflammation concerning your care, just know you got some swelling somewhere. And just say, oh, where's the swelling at? Boom. But it's swelling of the liver. So Hep B and C viruses can live on surfaces. Remember this. Hep B and C viruses can live on surfaces and can be spread without visible blood. Now, let me break it down into simple terms that you haven't thought about. How many patients go to a clinic that have a Hep B room, all right? And with the new HIPAA laws, You don't know who's walking around in the clinic that has Hep C, just like HIV. You don't know who has it unless they tell you. Now, with that being said, because you got to use universal precautions, that's what the staff got to do. That's why we put on gloves, a gown, and face masks. We have to treat everybody the same way. I can't go to Jack and don't wear nothing and put them on right quick and then go to Lou and put everything on. It doesn't work that way. You got to treat everybody the same way. Now, with that being said, what I read, Hep B and C viruses can live on surfaces and be spread without visible blood. Now, if you go to a clinic that got the room, Hep B, or you see somebody that's dialyzing in there, they don't got no separate bathroom for a Hep B or hepatitis patient. In fact, you don't know who has hepatitis C. What if it's that person who don't wash their hands after they hold in their site? They don't wear no glove and they bled all over the place and they don't wash their hands and they walked out the door because they was mad. They touching the door handle. They touching the door handles with bloody hands. What about the bathroom when you go use the toilet? Bloody hands on the handle. Does anybody wipe their handle with a bleach rag? No. Do you think about asking them? No. You go into the clinic because you focus on getting on dialysis and getting your treatment over. You don't think about somebody touching the doorknob, people walking in and out of the treatment room. That treatment room where you go into dialysis, the doorknob. Do you wear a glove when you open that door? Think of if you got a unit that has 30 patients and all 30 patients come, right? Lord forbid when you come second and third shift, you got to touch the door after all the patients who came there before you. And then even the door walking out to go into the street. That's the stuff I'm talking about. That's the stuff you don't hear and you can't get nowhere else. I don't care what show you turn on or what broadcast is out here, and I'm not taking anything away from any other people who are doing kidney disease shows, but when it comes to impacting a patient's life and keeping their quality of life intact in spite of having this disease, you need to know. And there's nobody giving you that information. You don't need a webinar. Wait around 2 and 3 weeks for a webinar from a doctor that's not going to break it down that worked in the dialysis clinic for 33 years. You're not going to find a nephrologist like that unless he was a tech and he went through and then he went to medical school, or some guy came from overseas and he couldn't pass the board over there and he working in the United States as a tech, and then he took the medical boards and now he's a doctor. That's the only way, because there are people out there like that. But there's no one out there, and I'm not saying this to brag, but I'm just telling you that other things, I could be doing other things. There's no nurse out here with a double master's degree prepared in education and leadership and management that's going to sit on here at 7 o'clock at night and use 30 to 40 minutes of their time when they be saying time is money now. I'm telling you. So that's why I get so passionate, because so many people are missing this type of information. And Lord knows, you can't say, oh, Steve, it's not that many people on dialysis. Are you kidding me? You know how many people on dialysis? That's why all those clinics are out there. So if you know somebody on dialysis that knows somebody that knows somebody, or a family member that know a family member that know a family member that knows someone on dialysis, they need to be watching these shows to know what's going on with their loved one while they're at dialysis for 4 hours and then they not there. They don't know what went on through the treatment. And then your mom or dad or your sister and them come home and they're, moping around, or they pissed off and you want to know what's wrong. Oh, nothing. they messed up my arm, but it's nothing. Are you freaking kidding me? It is something. So look, a bloodstream infection is a serious infection that can occur when bacteria or other germs get into the bloodstream. And so, like I mentioned, you touching the doorknobs, you going into the unit, you going into the toilet, or whatever you touch, in the counters, the machine. If you're taking your shoes off, getting on the scale, don't take your shoes off. I don't care if it's in the summertime and you got on flip-flops. Do not walk on that dirty damn floor with bare feet. You know how many shoes people could have stepped in, dog mess. I don't care, because you got so many personalities and different people coming into dialysis. You don't know where their shoes been. You got homeless people. You got people living in abandoned buildings. You got people that got bed bugs. You got all types of people. So you got to think ahead. You got to think ahead, guys. One way bacteria can enter the bloodstream, check this out, is through a vascular access, right? Vascular access. Let's get down to it. Either a catheter, which is the most common, the fistula, or a graft. Now, let me tell you something. Because I know it happens, because I've done it. I've been guilty of it. How many warriors, if you're watching this right now, it doesn't matter if you're watching now or after the broadcast, how many of you sat in your chair and they had an issue with your access, right? Sticking this needle in there, and then they digging in your arm, right? They digging for gold. They're like, hold on. They digging, and you holding back like, oh my God, will you hurry up? I mean, will you already get that needle in? They digging and digging, right? And then they pull it out and tell you to hold it or lay it down like that and maybe get it back and try to re-stick it in the same place. Has that ever happened to you? Have they ever told you, took the cap off with their mouth and told you to hold it for a minute while they do something? Or took it off and forgot some alcohol pad and took the cap off and told you to hold it, and they ran and got some alcohol pad and you holding it and this is exposed? Do you know germs can get on that while it's exposed? Because you got germs floating in the air, especially in the dialysis unit in a hospital. When you go to the hospital, that's where you can get what they call hospital-acquired infection. Yes, it's germs all over the place, but you're not thinking about it. You just want to get on dialysis, get that damn needle in, and let's get started. Time is wasting. But if they walking around the room, say, hold on, I got to get some gloves. Hold this, I'll be right back. Germs can get on this, and that's how it can get inside your bloodstream. Or if they don't wipe your arm, if they just use one alcohol, like a small alcohol, and they just do one strip like that and then stick it in, that's not cleaning your arm. And let me tell you, if they coming at you with, I should have brought my alcohol pads out, but if they come to you and with an alcohol pad, right, and they just wipe it like that, they didn't clean your arm, guys. Or they do this, they just wiping the dirt over it back and forth, right? This is the appropriate way. I want to show you. And learn this in nursing school, okay? And this is what the techs and the nurses, this is how they supposed to be cleaning your arm with the alcohol swab. So if they're going to stick, say like, you see my tattoo right here? Say right here, this kidney right here. Say that's my access, right? Like we're gonna make believe like this is the horseshoe graft, right? And they're gonna stick right here. What they supposed to do with the alcohol pad, and now DaVita, and maybe Fresenius, they gotten so cheap where the alcohol pads are small now, they're not the large ones. But what they're supposed to do is start in the middle. go inner to outer, like in a circular rotation. Inner, wiping it like this with the alcohol pad coming out. Get a new one, wipe it inner to outer. Get a new one, inner to outer. Same with the other one, inner to outer. That's how they're supposed to be cleaning your arm, not like this, or one strip and that, and be ready to stick the needle in. That's where you get the infection because of the recklessness and the laziness of doing the appropriate protocol and procedure. Okay? So, talked about that. Okay. So look, you want to know why dialysis patients are at risk for infection? You're like, why are we at risk for infection? I already got kidney disease. Why am I at risk for infection? Sorry, guys. Let me get my mic together. All right, my apologies for the interruption. But you may say, why are dialysis patients at risk for infection? Patients who undergo hemodialysis have a higher risk of infection due to the following factors. Check it out. Frequent use of catheters, right? Or insertion of needles to access the bloodstream. Frequent use of catheters or insertion of needles, right, to access the bloodstream. Weakened immune system, right? Frequent hospital stays in surgery. You go into a hospital. Remember I told you? They call it nosocomial infection. Look it up on Google. Frequent hospital stay because you can get an infection there. The germs are all over the place. Like a freaking wonderland. You just can't see it. You know, invisible to the naked eye, especially if you had surgery. Now I'm about to end this part of the series, okay, because I got a show about 35, 40 minutes back on Steve the Kidney Nurse. So tune in for that, guys. It's going to be an explosive show. This guy, Joe, lost 29 pounds in 33 days, and he was able to locate 42 people to put on the transplant list as a donor. So he's going to share that amazing story and how he did that. But let's talk about one last thing before I take you home. That's performing hand hygiene, washing your hands. The dialysis people supposed to wash their hands. If they tell you that's not a protocol, you go to the administrator or call the state. When should you, now listen to this, okay? This is from the CDC. So I'm going to tell you where I'm getting my information from. CDC. Okay? When should, come on. Hold on. Something came up. Okay. When should you perform hand hygiene? Right? Before you touch a patient. You just hear that? Before you touch a patient. Before you inject or infuse a medication, when the nurse comes and put that med in your venous line. Before you cannulate a fistula graft or access a catheter, right? I just said that. You got to wash your hands before they put that needle in or touch that catheter. After you touch a patient, so when you leave a patient, you got to wash your hands before you go to the next patient. After you touch blood, body fluids, mucous membranes, wound dressings, or dialysis fluids, right? After you touch medical equipment like the dialysis machine, it's a medical equipment, or other items at the dialysis station. After you remove your gloves, they're supposed to wash their hands for 20 seconds. At least 20 seconds. Remember, perform hand hygiene between each patient or station. And before I leave, let me just share this last statistic, which I went over, so you can think about what I just said about hand hygiene. Up to 1 in 5 patients with an infection die within 12 weeks. Thank you, guys. Let me read my comments before I go. Thank you, Mr. Ken Bressler, for watching Steve the Kidney Nurse. That's awesome. The Immunosuppressive Drug Act has passed the House today on the Senate. Breaking news right here on Steve the Kidney Nurse from Kent Bressler, host of Kidney Stories. Oh, I'm sorry. Executive Director of Kidney Solutions. My apologies, Ken. I get you and Uncle Jim mixed up. Okay, he said he already shared it. All right. Hey, Mr. Jared, how you doing over in YouTube? Thank you guys for watching over at YouTube, man. I appreciate you guys. Let's get it popping over there. Thank you, man. I appreciate doing this. So, guys, thank you for watching. I'm going to get a little bit of de-escalation, man, before the 8 o'clock show. I thank you again for watching. Have a good evening. Peace and blessings again. Stay safe, man, in that unit. Stay safe. Let me put that banner back up. All right. And if you're interested in the Kibo subscription plan, if you're not on dialysis, or even if you're on dialysis, or if you got low kidney function and you want to try this product, and I already mentioned that this product has not been evaluated from the FDA, all right? And it's not intended to diagnose, treat, cure, prevent any diseases. And with that being said, we got a special going on with Kibo. We got a special only through Urban Kidney Alliance. You can get on a subscription plan, $51 a month. And on that first deal, you're getting, I keep the, I took the pictures down. I don't have it on this one, but you get a bottle of Kibo Renadil and a bottle of Kibo Fortis Fiber. It's a multi-fiber. And this is a probiotic. So don't let nobody tell you that these don't work, because it does. Your boy James Fabian, a.k.a. Dad Vice TV, who has over 100,000 YouTube subscribers using this product. So we see you guys on the other side. God bless you. Stay safe. Watch the unit. Make sure they're doing what they're supposed to do, and you shouldn't have any problems. God bless you. Stay encouraged. Peace.
Uh-huh.